On this episode, Todd Soura and Dr. Eric Kephart discuss vitamin D and its effect on your health and immune system.
This is Todd Soura with Action Personal Training for our second segment with Dr. Eric Kephart of Kephart Integrative Medicine, located in Doylestown. Today, we are going to discuss vitamin D and the immune system and benefits it can play. Last week, we discussed growth hormone and those benefits. So we're going to hit this subject today. Eric, Dr. Kephart, would you like to say anything?
Thanks, Todd. Yeah, this is great. This is timely type of information, I think, with what we see going on in the world and talking a little bit about our immune system and something that we may not correlate that with, which is vitamin D. And so we'll try to get some information out there that will help us understand vitamin D a little bit more and the role it plays in our health and the function of our immune system so that we can be the healthiest person that we can be.
Awesome. And one of the first questions I want to ask before we get into exactly what vitamin D does for the immune system and how the immune system functions is, and it's also a personal question of mine. And I've read a couple different things, and I've been a little confused about it. I've read that vitamin D is known as a vitamin, but I've also come across information suggesting that it is a hormone rather than a vitamin, or some hybrid. So could you explain what that means?
Yeah, exactly. I think it's kind of misleading because we always see or hear it's vitamin D, and actually what it is in the body is it's a hormone. It's pretty unique in the way we get it and how we use it in the body.
Okay, well, let's touch on that before we jump to how valuable it is to the immune system. How do we get it, and how does it interact with the body?
Yeah, vitamin D, the number one best way to get it is through sunlight. So when sunlight, the UV rays of the sun hit our skin, a reaction takes place in which the body produces something called vitamin D3. Vitamin D3 is called a pro-hormone, essentially that gets converted in the liver and kidney to its active form, a hormone called calcitriol that the body uses. We can get it through our diet. It's a little more difficult in getting enough through just diet. The sun is the absolute best way to get it.
And just to grab hold of something you said, and just as a side note, you don't have to go into too deep about it, but I do hear a lot about vitamin D3. Are there other forms? Is there a D1? Is there?
Right. It's essentially, it's just the conversion of it. The form that we would supplement with is the form that you get through diet and your nutrition or supplements, or from the sun. Initially comes as a result of vitamin D3, then it's converted to get to the active form that we use, which is calcitriol. So there are various forms that are that come along down the chemical pathway of getting to the active form.
Okay, good. And I guess just in a nutshell, or maybe more than a nutshell, the importance of vitamin D to the immune system.
Yeah, so we know vitamin D is important in bone mineral deposits, with calcium, and that's true. And what we have found are vitamin D receptors. And one of the big systems that has a lot of vitamin D receptors, or VDRs, is the immune system. In just about every aspect of our innate and adaptive immune system can be affected by vitamin D receptors. And the only way to have those receptors do their job in the immune system is to have vitamin D available to join onto these receptors and then cause that process to take place. So that's why we see if we have low vitamin D levels, that we can see immune system and immune function not function properly. That's when we see, chronic infections. I get a cold. I've had a cold for the last 6 months. I've been coughing forever, or symptoms and signs that the immune system isn't working properly, it might be an idea to check out the vitamin D level. It might be as simple as that. And then we can talk about how you replace it. In a place, we live here in the Northeast, it can be difficult to get the necessary sunlight exposure to have adequate levels.
So would basically the immune system fail without vitamin D?
Yeah, it will struggle to the point where, you could get sick to the point where you need help, and that's whenever you would seek medical care and get antibiotics on board, and would like to see our body and our immune system function at a high enough level so that we can deal with a lot of that. There are pathogens, viruses, bacteria that we come in contact with every day. We got to wash our hands, but as much as we do those things, we're still exposed, which is okay when the immune system is functioning properly.
And again, just to go a little sideways here, I know basically our bodies, depending on our health, we basically fight what I've heard, cancer every day. We're constantly fixing our DNA. If vitamin D, is vitamin D part of that process? Does it help the body make that fight along the way?
Yeah, yes, there are some other supplements and elements that have gotten more attention in the anti-cancer type world, but at the very basic level, of a couple things that we want to keep in mind of with our health is decreasing inflammation in the body and then improving our immune system function. So those go hand in hand. If we have a chronic inflammatory state in the body, we have a decreased immune function that's going to occur. So what we need to do is work to decrease total body, and we'll touch on how can we improve our immune system. And it's not just vitamin D supplementation; it's one of the parts of it. But if I had a healthy immune system that was able to fight off any of the abnormalities that come through the immune system, then yes, I mean there's going to be some evidence that it's not an anti-cancer drug, but it's going to give your body the ability to recover, heal, and function better at a cellular level to promote that health. That we get cancer. Cancer is something that the cells are mutated. They mutate because they can't recover or heal from a abnormality. Maybe it's in their DNA transcription, etc. So if the body's working best to correct all those problems, and that's part of the immune system, yes, we'll have a decreased chance of those cells, perpetuating themselves.
Awesome, great. Well, the how do we know what level of vitamin D should we have, and then how do we find out if we have it?
Yeah, so we would take it's a laboratory test. You can go to the lab and get it drawn, or and actually here we have a way of checking your vitamin D level with blood microsampling, which is just a little finger prick of blood that can be sent to the lab, and it's a little less invasive. You'll get a value, essentially. It classified as to whether you have sufficient or insufficient, or you're deficient. What we know and what you can see and read in study after study is some of the studies say that we're in a vitamin D pandemic across this world, as in our vitamin D level on the whole is just not what it should be. And most physicians would recommend supplementation.
If it is tested low, and it sounds like many of us will be, how is it given besides going out and getting sunlight? Is it a capsule? Is it an injection? How is it provided?
Right. So the sunlight and UV is the absolute best way your body does it. And like I said, we had to be careful with the sunlight. Diet, we get some, not enough to be sufficient, I would say. And so the other way then it would be to supplement it. So you supplement with capsules. So you can take a pill. You can take, and there's various regimens there. Take it every day, take it once a week for a period of time to get levels up. And there's also an IM injection in which that works a little bit differently in that what we see with the injection is we have the levels come up and they stay up for a little bit longer period of time than taking a pill. So for folks who don't like the pill so much, that's an alternative way of really, we can get the level where we need it to be.
Okay. And I guess, dosage is dependent upon their level of or deficiency.
That's right. Yeah. And that's going to be, related to talking to the patient, see what they want to do, how they would like to get their level up. But it could be, the numbers are much higher than what you probably would see on the vitamin D bottle at GNC or Walmart or stuff. It could be 10,000 international units daily. It could be 50,000 international unit or 100,000 international unit injection or pill, once a week. So, and those they will not be toxic to you, especially we check the labs, but you'd be surprised. You can really take a lot of vitamin D, tolerate it well. It's tolerated to get your level to where it needs to be so that you can function well.
Cool. And I guess, and I just want to wrap up with, beyond the vitamin D, what would some of your recommendations be in general to help boost your immune system in addition?
Yeah, it's great. And it's a great point to get across from a health standpoint. There are some things that we can do that improve our immune system and immune response. The first one is going to be, I'll say, a healthy diet, or, maintaining a healthy weight, eating a healthy diet. So we live in a fast food world, and that's not always the best, right? And you go to the grocery store, and probably the best way to do is go out around the edges and pick up everything that has a color, eat all the colorful stuff.
Shop the perimeter.
That's it. Shop the perimeter. Get all the colorful, veggies and fruits, and, those will be beneficial to you. Maintaining a healthy weight. Sleep is so important to our immune system and our body function. The other thing that's really important from immune system function is our stress level. Reducing stress is vital to our function and how we can deal with all kinds of adverse events, and especially, viruses or bacteria or things that we may interact with. So reducing stress, maintaining a healthy weight, sleeping well. And then there are some other like vitamin A, high dose vitamin C, zinc, glutathione. Those are things that are additional, supplemental things, which we do. We do that here too. We can do that through IV therapy type things, and those are additional type measures. But there are some simple things that you can do at home right now to help your immune system function at its best.
Well, it's funny you say that, because people that know me well know I recommend chicken and beef liver quite a bit for their high vitamin A dosage. All right. Well, thank you. I'm Todd Soura with Action Personal Training. We do private training in-home for private clients, and we do training at the office for businesses. And this is Dr. Eric Kephart, and I'll let you finish with
Kephart Integrated Medicine at 403 Hyde Park, via telemedicine right now, and by appointment for some of the other services like PRP injections. These are great times to be thinking about how healthy you can make yourself, because we're going to encounter things out in the world that we need to be our best self to deal with appropriately.
Awesome. Well, all right. Thank you, Dr. Kephart. I appreciate it. And we're going to talk again next week, and we'll be bringing this to everybody.
Great. Thanks a lot.
All right. You got it. Thanks.
Thanks.